Nito ko tetutietab tililindo ole inyorune logoiwek tugul chetinyegei ak kanyoiset cheboto kanetisiosiek chetoretin eng teretab mionwogik.
I am Dr. Anjumanara Omar.
Kainaik kekurena Luke Kipruto Arap Tuitoek.
My name is Dr. Justine Jolagatodiuni.
My name is Dr. Waweru Monyo.
I am Dr. Shrikant Dalwadi.
My name is Dr. Frederick Kairithia.
My name is Dr. Beatrice Nganso.
Testai iger tetutietab tililindo eng KASS TV amu kimnatet naet.
We really appreciate you for making time for us this evening. Thank you. Hello and welcome to Tililindo program. My name is Chemtai Kirui. Just to appreciate Chesankar, who was here earlier introducing the program and telling you who we are having here in studio. But before I introduce our guest for tonight, I just want to say that we at KASS Media Group are standing with the whole nation as we are commemorating the passing of Right Honorable Raila Amolo Odinga, and today is the 5th day of mourning, and the world over are actually still sending in their condolences, just to remember a man who did a lot when it comes to the issues of democracy, justice, and also unity, not only in Kenya, East Africa, Africa at large, and now the man is being commemorated throughout the world. Today is also Mashujaa Day. But on top of that, October as a whole has been and continues to be a pink month. We're talking about breast cancer awareness month. Here is a moment where people are coming together to talk about raising awareness about breast cancer, also calling for you to go to the nearest health center and get yourself screened, and also support survivors who are fighting the issues of breast cancer, and also to remember those who've lost their battle with this disease, and also to mobilize action and funding towards the support of individuals fighting the issues of breast cancer. And it's with this in mind that I'm privileged to have with us in studio, not a new face, Nancy Andwati from the Arise Against Cancer, who was here before, being a friend to the program. Thought this is the moment for her to come back in and just continue this conversation. Karibu sana, Nancy.
Thank you.
We really appreciate you coming in. And I love the pink. I wish I'd got the memo.
Yeah.
Yeah,
This
looking really
month
nice.
we try a lot to put pink because many people associate breast cancer with pink. Yeah, so we try so hard to put a pink here and there. Yeah.
You're looking really nice.
Thank you.
And thank you for bringing the pink in the month of October.
Thank you.
Yeah.
Your nails are also pink.
Yeah, I know. I'm holding to that. Thank you so much, Nancy. It's always a pleasure to have you come into our studio, because I know there's a lot of conversation happening, especially this month when it comes to Breast Cancer Awareness Month. And I know you have something for us in terms of what to expect soon, right? Something that is being planned soon.
Yeah.
Our audiences on the screen are seeing the issues of science of hope and collaboration, and the inclusiveness that comes when you're talking about representative discussions about breast cancer awareness month.
Yes.
We have it on screen, science of hope. Probably you can tell us what that means.
My name is Nancy Andwati, and thank you very much, KASS TV, KASS Media, for being so proactive in matters of cancer. Through you, we are able to create awareness across the country. Thank you very much. So the science of hope for me particularly, what that means is what people have put into the research towards improving treatment on cancer. What the pharmaceutical companies is a pharmaceutical company somewhere that has put so much money into producing good medication for cancer, improved medication that will improve our life, the way we live. You know, in the past, when somebody had cancer, the treatment alone could actually kill. But now we are seeing that we go through the treatment, we go through that same chemotherapy, but because it is so improved, you find that many people are not dying. Actually, I would stand here and say, God used the doctors, God used the industry to heal us, because through them, God has used them to come up with this medication that is so improved. I would say today, if chemotherapy was a person, it would say, mimi ndio niko mutadu. And I'm saying that particularly because of my own experience, and I would say that chemotherapy did it for me. Chemotherapy killed the cancer cells in my body. Right now, I don't think there is anything else that will kill those cancer cells. If you are diagnosed with cancer, once you're diagnosed, listen to your doctor. If the doctor decides that you're going to do chemotherapy, please go ahead and do it. Chemotherapy does not kill anymore. It only kills the cancer cells in your body and gives you at least some hope to live. Don't fear chemotherapy and say, no, let me try something else. I did that, and I was diagnosed in September 2021 at stage 3, breast cancer stage 3, grade 3. But because I was buying time, listening to people, you know, you have all sorts of advice from people from everywhere telling you, oh, we have a herb here that can cure you. We have this medication that can cure you. And because of buying that time, by the time I was starting my treatment in January 2022, I was at stage 4. So you see, I put my life at risk because I thought there was any other kind of medication that would kill the cancer cells in my breast. But as soon as the doctor prescribed chemotherapy, and as soon as I started the treatment, on my second session, my breast was already gone down. The lymph nodes were already disappearing. So actually, for now, do not get scared of chemotherapy. If the doctor tells you take chemotherapy, please take it. It will take you about 6 months to go through the cycles, but your life is more important than the side effects. And the side effects have improved because of this science that we are talking about. They are not as bad as they used to. Yeah.
The side effect, I think before we look at the improvement, yeah, would you say that some of the reasons why people fear going through chemotherapy, or some of the messages you are getting as a new patient, yeah, what would necessitate that? What would make people pass this message that, hey, you need to stay away from chemotherapy? Would you say side effect is one of the top?
Yeah, I think it's the side effects, and 2, there is a narrative that goes around that chemotherapy is a chemical. Yes, it is a chemical. However, it is that chemical that will kill the cancer cells. Yeah, and because we hear it's a chemical, it's a poison, it is not a poison that is going to kill you. It is a poison that will only kill the cancer cells in your body, in your blood. So that is the fear that goes around, that if somebody takes chemotherapy, they will die. If somebody takes chemotherapy, it will kill all the cells. Yes, chemotherapy kills the good cells, a few of the good cells, but mostly focuses on the bad cells, the ones that have cancer in them. So much as chemotherapy will also disrupt some of your good cells, the good cells will rebuild as you go within the weeks. What is more important is once you start your chemotherapy, you also have to eat well, follow the nutrition advice that you have been given, eat a lot of vegetables, take a lot of fruits, a lot of fruit juices. If you think your mouth has maybe blisters because of the dead cells, then you can blend your foods, but make sure you eat well. Most people actually die from chemotherapy because if you are going through chemotherapy and you're not eating, my friend, you will die. You must eat. Yeah, that is the fear that is there. But chemotherapy now is the treatment that is there for cancer, unless your doctor prescribes otherwise. Yeah.
Nancy, here in KASS Media, we say Kim Natet Night, meaning knowledge is power.
Yes.
And the Bible says a lot of people are destroyed because of lack of knowledge, right? So from what you're explaining, the fear and what is really happening is different with the science.
It is different completely. Medication has improved. The science, that's why it is science of hope. This improvement is what is giving us hope. This medication is what is giving us hope. And because I'm here living, remember by the time I was starting treatment, I was at stage 4. And here I am speaking and giving you hope, telling you that chemotherapy will not kill you. It will actually, that is where your hope lies. God has used your doctors, these people in research, your medication, God is in it. So just keep trusting God that the prescribed medication is going to cure you. And indeed, you'll be cured. Yeah.
You've said that medications have improved, yeah? What do you mean by that? What are the changes?
What I mean by that is in comparison with the past. Even before, way before I was even diagnosed, I have very many people I know very many people, some of them family, who lost through treatment. And I do believe that it is because of the, maybe people did not know how to navigate around the treatment. Now I have been there, so now I know better. I know that if I'm going through chemotherapy, I must eat properly. I must make sure I do not throw out anything that I'm eating, because every time you throw out, then you're throwing out your nutrients, and you do not want that. So right now, the medication has really improved, and you'll find that the kind of effects that used to be there in the past is not there. For example, myself, the kind of effects that I went through were not as bad as those that I have seen with previous people who had been diagnosed with cancer. They were very different. Yes, I had those effects, but because the medication has improved, they are not as bad as they used to be.
Biggest changes over the years, right?
Yes,
that's
over
what
the
you're
years.
saying, like you're seeing improvements.
Yes, it's improvement. I think research, these people do not sleep. The researchers are not sleeping. The pharmaceutical companies are not sleeping. Maybe just to name those that can come on my head, we find like Pfizer, we have like AstraZeneca, and we have many others, even those with equipment. All of them are working collaboratively to, to make sure, to ensure that the medication now is improving by the day. And I do believe that in the very, very near future, cancer, even those effects might not be there anymore, because these people are not sleeping. They're actually doing research, and every day somebody is coming up with something new towards the treatment. And you find that because of this improvement in medication, you find that we have very many of us now surviving after treatment. That just shows how medication has improved. So science is really giving us hope.
And I love what you're saying, that every day these individuals who are working towards ensuring that every day the treatment is changing.
Yes.
And if someone is sitting at home with the mentality or the information that they have from previously, then it becomes an issue, right?
It becomes an issue, and that is why you'll find Arise Against Cancer, it is an NGO, and we have many other people out here. That it is very important that we go out here, and for example, because I have experienced it, if I'm able to speak to somebody and tell them about it, and tell them that the treatment is not like the treatment in the past, then you see the fear will always, as we demystify this fear, people get now to say, oh, okay, actually if I do the treatment, then I'll get better. After all, Nancy is now much better.
You've mentioned Arise Against Cancer, which is an NGO. Earlier on you mentioned research and doctors. On the screen they're seeing word collaborative, and sometimes you see these big words and you're like, what does that really mean? Do you mind explaining exactly how these people are coming together to ensure that there's change in patient care?
Yes. When I talk about collaboration, I'm talking about all the way from research. Researchers collaborate with pharmaceutical companies. They tell them this is what we have researched. Pharmaceutical companies come up with a drug, bearing in mind what the researchers have come up with. The pharmaceutical companies will now will advise the doctors, the oncologists, on how to administer this medication, what to mix into this one chemotherapy pot that they do. You know, chemotherapy actually it's a medication that is all put together, different types of medications put together to come and fight that cancer cell. So you'll find that now then, besides the doctors, we have the nurses, we have neurologists, we have a whole line of people. It is a whole industry working together. None of them can work in a silo. They have to work together. And while they are doing that, then now we have also the civil society like us now coming up and saying, how do we support this industry? How do we support the pharmaceutical companies? How do we support the researchers? Our business here will be to tell people we have good medication that has come up. Do not get scared of going for it. Please go for screening. You know, the screening also they use they use what the pharmaceutical companies are for you to be able to be screened. The equipment, everything that is used maybe in mammogram, even when they are taking your sputum, when they are taking what, it is all about industry. So we tell them, please go for screening. Once you're diagnosed, listen to your doctors. If they tell you you're going to take this number of cycles of chemotherapy, please take. If they tell you you're going for surgery, you remember now we are bringing in surgeons all. It's a whole collaboration, because the pharmaceutical companies and the doctors will use the chemotherapy to treat you. Then the surgeon will come up to look for any residues of cancer that is remaining so that they can remove it through surgery. And then now you'll go down again, you find we have the radiologists. That's why I told you it's a whole industry, a whole line. The radiologists now will be told by the oncologist, this is what you need to, this is where you need to apply your radiotherapy. Then you'll find that when we are talking about the whole line, we are talking also about skin care. Because once you start chemotherapy, your skin is affected in different ways. You'll find that like for example, for myself, I'll speak for me, and I know that that's what happens when you start chemotherapy. Your hands will become very dark. Your fingernails will become dark. Your tongue will become, and then you can start getting things like acne, your spots that are dry, everywhere. So the skincare also have to come in and now advise that you can use this particular treatment on your skin. Because in this case, we are telling people, do not just use any lotions you find on the counters. Do not just use any medication for your skin. When you're going through chemotherapy, you must avoid some chemicals that will come into in contact with your skin. You must avoid those ones. We talk about skincare. There's also for your hair, because you see your hair will fall off, and I know that with the improvement in treatment, in future I have a feeling people's hair will not fall off. And I'm hoping that people's hair will not be falling off. So if your hair is falling off, how do you take care of your scalp? Because this scalp has now become vulnerable. There's nothing covering it. That is now.
You're speaking of hair, and I'm looking at your hair and how beautiful it is, you know, and how full it's, from the last time we were talking to now, there's that improvement. And also, Nancy, there's this thing you are mentioning about not working in silos. A lot of people actually are working towards ensuring that there's care for cancer patients, and the focus on details, even when it comes to skincare. Right? Because women, I don't know about men, I'm not a man, I can't speak on it, but for women, you want to look beautiful, you want to look presentable, you want to look nice, and some of the people going through treatment, and then the skin issues, like you're saying, someone might feel like they go towards like mental health issues and things like that, but you're saying that there's this, also you need to consider what exactly you're using for your skin, right? Because there's that quickness of, oh, no, I want to remove the darkness, and you're hurting yourself.
You might be tempted to go and start using very harsh chemicals on your skin. Remember that the chemotherapy has killed some of your white blood cells and the red blood cells, so your skin is very vulnerable. At this point, you cannot just apply anything on your face. Personally, I was using everything natural. Even now, I use natural oils for my skin, because I do believe that since I have been through that, and these natural oils are what helped me, why don't I just continue with them? Because they helped me at a time when the skin was so bad during chemotherapy, and now you can look at my skin. So there is hope. There is hope. And when you're going through chemotherapy, do not get scared and think that when your hair falls off, then that is how you will live forever. No. Look at me now, I have my hair. Normally after chemotherapy, give yourself another 2 months after you've completed chemotherapy. After 2 months, your hair will start sprouting. So there is hope. There is hope in the treatment. So even your skin will improve. The dark parts will go, so don't get scared. Don't get scared of people who will be staring at you. They do not know what you're going through. So don't get scared. They might make nasty comments. And that is why we call, when we are doing awareness out here, we are asking people, when you see a woman with bald head, do not make comments, because you never know. It could this woman may have lost their hair to, because of the chemotherapy treatment. When you see their skin is dark and they used to be brown, you know, some people can go ahead and say, like, for example, I became very black. You see, people who knew me might think that I had bleached before that. But you see now, because of chemotherapy, the treatment was very harsh, so my skin turned black. Yeah. So we urge people not to be making unnecessary comments when you see somebody, unless you really know why they are looking the way they are. Please do not make those comments. Yeah.
Yeah. Kindness and considerate.
Oh, yes.
You don't
have
want
to empathize
yes,
with somebody.
with
Yeah.
someone.
Yeah.
There's something you mentioned, Nancy. I want to take us a little bit back on the issues of screening. Yeah. Before even going to why it's important to have screening, I don't know, with this month of October, if you know of special places where people can go and get their screening, either in a limited amount of money or for free. Are there some initiatives like that?
Yeah. Government hospitals, county hospitals, the clinics, you can go there and talk to them and they will do for you screening. You know, when we talk about cancer, especially when it comes to a woman, personally, I would like to talk about the holistic woman. So when I'm talking about the holistic woman, I'm asking, please go for screening. You go for breast cancer screening, but also go ahead and do a cervical cancer screening. That is very important, because I talk about those two because this is the whole woman being affected. Yeah, so always do the two. But go to the county hospitals and government hospitals. Sometimes you could even talk to your own doctors. You never know. You can tell them, I would like to do this screening, but I don't have the money. Yeah? They can look at you and think, then look that you actually need that screening. And I'm so sure that they can assist. So don't get scared also. And if you can afford, some of them are not very expensive. You can always negotiate through. And always look at the Cancer Awareness Month. There are some people who offer free. And for example, like now, what I'm trying to do as Arise Against Cancer, I'm urging all the county governments, can you please make accessible screening points? Even if you can do the mobile screening, go down to Mashinani, go down to the wards, organize with the churches, please go and do screening for your people. Remember that every person who dies from cancer, that is a vote that will give you another chance to be in government or to be in the position that you are. So if you ignore them, and I will not mention any county at this time, but unfortunately there are some counties that do not even have a cancer center. You'll find that people have to travel all the way from their villages, go maybe 100 kilometers away or 200 kilometers away, one, to do screening, or two, because they have been, the doctor has told them there is something suspicious, they have to go so far to get the diagnosis right, which I don't think that is right at all. I don't think any county should not, at this time, we have a budget that has been given to health. Even if it is a small cancer center, please, every county should have something that their people can come to for treatment. I did chemotherapy, and before you do chemotherapy, you do not want to travel 50, 100, or 150 kilometers to go and do your chemotherapy. You do not want to do those same kilometers back after you've done chemotherapy. That is going to slow down somebody's healing. And also the transport. When we talk about the fare, many people at home cannot even raise money for their food. Now you're telling them you have to go 100 kilometers away to go and do the treatment. Chemotherapy is not just one cycle, it's several cycles. So somebody has to go several times. Sometimes you're given an appointment to be at 8 in the morning. If you're coming 100 kilometers or 50 kilometers away from the village, how will you make it to that point at 8? You get there and your time has gone, you have to go back without that treatment. And because you find that maybe the only county that has the cancer care center is that 150 kilometers away. That means they are taking care of many other neighboring counties. So imagine you go there and you've been diagnosed with cancer, and then they tell you, come back after 3 weeks or 3 months. Cancer does not wait. The moment you are diagnosed, it's like the cancer cells have ears. You know, they start growing very fast. They multiply. They're actually demonic. For me, they are demonic because the moment they are diagnosed, that's when it goes chap chap. Yeah. So I'm urging that every county should have a cancer center. You can work with National Cancer Institute. Go to them, discuss with them, and find out how they can work with you. Those are the collaborations that we are talking about. We have some pharmaceutical organizations that work with some of these cancer centers and help you set up the laboratories that you need. You don't need to keep quiet on cancer. This is not a political, cancer is not a political game. Keep it away from politics. It doesn't matter whether you're in government or not. Every county should have a cancer center. Yeah.
I don't know why I'm getting angry, Nancy, when you're talking about counties, you know, lacking cancer center. Do you know how, I don't know, I'm getting so mad to hear about it, and I'm hoping someone who is watching at home, you have an idea of where you can go for this cancer treatment. If you don't, please, the next time you're sitting with your leaders, whether it's an MCA, MP, like that's the #1 thing you need to raise up and ask why. Because
it is a basic need.
Yes, cancer is in your home, it's in your church, it's in your neighbor's place, and from what Nancy is saying, like that trekking and all that, you can only imagine.
Chemtai, imagine, right now, I'm so sure very many people in villages are dying, and people do not know if they died because of cancer or what they have died of, because they have never gone for screening. They have no idea, you know, because no one has talked to them about cancer screening. Yeah, you find that when people are doing their campaigns, maybe to go into parliament or to go into ward, they are talking at everything else, nothing to do with cancer, nothing to do with healthcare. And for me, healthcare should be a priority because that is a basic need.
Yeah.
Cancer is becoming a pandemic. If we do not take care of it, I feel so bad that in the past, okay, right now, because I've been there, I know, I speak to people about it. But imagine in the past, no one is talking about cancer. So people are just dying. You find, you'll go because they even do not have, unfortunately, Chemutai, there are even some of these counties, and I said I'm not going to mention any right now.
But I think with time we're going to shame them.
Yeah, some of these counties do not even have oncologists. That is how sad. That is how sad.
Right now we are having numbers coming in, Nancy, saying that Kenya is one of the countries with late diagnosis.
Yes.
This is one of the reasons.
This is one of the reasons.
You don't even have transport to go to the next city town, and yet your county has money for, you know, for the doctors' centers to be built there and all that. I think those are some of the things we need to be raising up.
Yeah,
and
as we speak today, in some of those counties, again, I will not mention which ones, but we are talking to them. You find that any woman who has already cancer growing in them, by the time they are diagnosed, they are at stage 3, going stage 4, because they did not even know. There is no awareness. No, there is nowhere they can go for screening. They have children, you're dividing. Do I use this money to feed these children, or do I use this money to travel that far to go for screening? So people just stay at home. They don't do screening. Yeah, that's the unfortunate bit of it.
And some of these cases are preventable. Once preventable and treatable as well.
If you go, that's why we are advocating for people to go for early screening. When you go for early screening, and remember, going for screening does not necessarily mean that you'll be found with cancer. It will only now give you hope to know that now you're living and you're okay. You'll now maybe change your lifestyle, eat better if you are not eating better. However, if you go for screening and a cancer cell is found in your body, it will be found almost at 0 level or at stage 1, which is so easy to treat. If you do not do the screening and it is found at stage 3, then the treatment becomes more difficult. So we are trying to say that, people should go for screening so that all cancers that are found at stage 1. We don't even want stage 2. It should be found at stage 1 if screening is done. Yes, if screening is facilitated. And who can facilitate this? It's the county governments. Together, collaborate with the national government. I mentioned National Cancer Institute. Collaborate with them. Let them give you advice of what to do. But you just don't sit there. There's money for health, but cancer is not a priority. That is just not right. Yeah.
It's not.
No one should die because of cancer in these days of today.
Exactly. Today you came here, we started with Signs of Hope.
Yeah.
And you sitting here as a testimony, like there's medication, there's treatment, and there's hope. And then someone is sitting at home being hidden because of taboo. I come from communities where there are people who are still hiding someone who is sick, right? And then they come up later when the issues is complicated and it becomes even more expensive and probably die at that time. You know?
Which is very sad because you'll find that, some communities up to today, because no one has talked to them to tell them that cancer is also just a disease like any other disease. When a woman is diagnosed with cervical cancer or breast cancer, they say like this is a bad omen, and so they start isolating you. I know some of those communities, and we have spoken about them in various sittings and all that, And right now, even without thinking about those communities, the reason why people are in their homes, you have a swollen breast because of cancer, you do not know it's cancer, it will burst. Just last week, 2 weeks ago, I was in a certain county and I was speaking to one of the nurses and they were telling me, hey, imagine some women come here and the breast is bursting out. That is how bad it is. Imagine cervical cancer, you have cervical cancer, and because no one has diagnosed it, you're not on any treatment, the woman will bleed to death. The woman is walking around with so much pain. And cervical cancer, even people do not want to talk about it, just like prostate cancer, because, people misunderstand. They will want to think that because you have cervical cancer, maybe you have been promiscuous in the past. No, cancer has nothing to do with your sexual habits.
Yeah.
Cancer is just cancer. Please go for screening. Facilitate people to go for screening. Facilitate people to get diagnosis. Get cancer care centers in every county.
Yeah.
Yeah.
Yeah. I need to breathe, Nancy, because I'm getting emotions are going up. Please let us go for a short commercial break. When we come back, we're going to continue this discussion of Signs of Hope and what we need to do to ensure that we are battling these issues of cancer together. Don't go so far.
Testai iger tetutietab tililindo en KASS TV amu kimnatet naet.